All right, all. Well, I want to thank Kenny and everyone at Strong New York for having me. It's very great to be with you all. Who here regularly saunas? I saw a few people. Okay. And infrared sauna mostly. There's higher dose. There's a lot of businesses here that have infrared saunas, which is fantastic. So just backing up, Kenny wanted me to talk about three things: sauna, cold plunge, and then maybe a little bit of blood work. Who is interested in learning a little bit more about blood work? Okay, so we're going to get to that, but we're going to break it down in 7, 8 minute chunks and then move on. So sauna therapy is arguably one of the best ways, in addition to exercise, to reducing your risk of cardiovascular disease. As you heard us talk in the panel session, cardiovascular disease claims more lives than any other chronic condition that we can name. More lives than COVID, more lives than cancer, Alzheimer's, and beyond. So statistically, many of you and your clients and your friends and family will die prematurely, unfortunately, from cardiovascular disease. And if there's one modality or intervention that you can implement today, in addition to exercise, it would be implementing sauna therapy into your lifestyle or your clinical practice or your coaching business to reduce the risk of cardiovascular disease. Various studies in Finland, Sweden, and various parts of Europe show that people who sauna have a 63% reduction in sudden cardiac death. Okay? Many people who just have a heart attack, chest pain, and die, that's from sudden cardiac death. So longitudinal studies in thousands of people in Finland have shown that the more that you sauna consistently, there is a linear dose-response relationship that is correlated with a proportional reduction in cardiovascular-related events and sudden cardiac death. And all-cause mortality, people who sauna 3 to 5 days per week can reduce the risk of all-cause mortality by 40%. Okay, there's not a drug on the market that has this much of an efficacy in terms of reducing cardiovascular disease and cardiovascular-related events. So that's, I think, the most important thing. And I think secondarily, who here's a trainer or works as a coach? Okay, majority of you. New studies are showing that people who sauna increase a critically important enzyme system known as the heat shock protein system in the body. And it turns out that the heat shock proteins help with muscular hypertrophy and muscular repair. So as a coach or someone who wants to improve your body composition in your clients, it would behoove you to recommend sauna after exercise, because you are going to encourage the recruitment and the repair of the damaged muscles during the exercise intervention. Does that make sense? Okay, so it turns out that athletes have a significant increase in this heat shock protein response after they go in the sauna. And we can encourage this same system to increase in people who are sedentary. So as I just mentioned, sauna is really great for people who exercise, but it's even more important for people who do not exercise. Because what happens when we exercise? We move blood, we move lymph. Who's heard of lymph stagnation? It's an under-recognized but very important contributor to chronic inflammation. So when you're moving your muscles, you're moving blood, you're moving lymph. Guess what happens when you go in the sauna? You're moving those same tissues, blood and lymph. Your blood volume increases, your heart rate increases. We talked about adrenaline and noradrenaline, these hormones that help us feel good but also burn fat, increase. So it's a great way to improve circulation. Many of you know, sometimes some people don't get off the couch. The most movement they do is to get up to let the Uber Eats delivery person into their door, right? So we all need to move more, and we can pound people, hey, you have to walk 10,000 steps per day. No, 12,000 steps, you gotta lift weights. Most people are just not gonna exercise or move as much as we need them to. So sauna is a wonderful tool, especially for people who don't exercise, because the heat in and of itself is moving blood and causing muscular contractions and contractions of the major vessels in their body that is mimicking what exercise does. That's the most important thing to take away from. Sauna is an exercise mimetic, and it augments exercise. It will help improve some of the benefits of exercise. Moreover, as many of you know, what's the prevalence of metabolic dysfunction in this country? If you were to just look at the random glucose of 10 people, how many of those people would trend towards prediabetes? Anyone want to guess? It's more than 8. 9.6. About 96%, and this is pre-COVID. We all know what happened to people during COVID, because they stayed home, they ate junk, right? So 96% of American adults are on some degree of prediabetes, metabolic dysfunction. So most people, as I mentioned, statistically will die from cardiovascular disease because of their underlying metabolic dysfunction. insulin resistance, hyperinsulinemia, poor glucose tolerance. It turns out that getting hot, any form of heat, by the way, we did the panel a little bit, talked about saunas. We're talking about hot tubs as well, hot yoga. It's not just relegated to a Finnish sauna. That's the gold standard. But getting hot in any modality, steam room. Some people don't like the sauna, but they like to go in the hot tub. Research from the New England Journal of Medicine, arguably one of the most reputable medical journals in the world, back in 1992 found that when insulin-dependent diabetics go in the hot tub, guess what? They need less insulin. They require less insulin just because they're getting hot. There's anti-inflammatory properties, they're moving blood around, their muscles are contracting, everything. So it improves metabolic health, reduces death from cardiovascular disease. And let's talk about inflammation. I think this is really important because most people, we're going to get into labs in a moment, most people have elevated levels of a biomarker known as C-reactive protein. Many of you know this. Who here has tested their CRP? In this population, it's probably quite low, maybe 0.1 or 0.04. But in the average American, their CRP is north of 1. Most people are chronically inflamed from their sedentary activity, their sleep apnea, their sleep disorder breathing, persistent organic pollutants, processed food. There's all the litany of things that cause inflammation. Getting hot, going in the hot tub, going in the sauna, doing hot yoga reduces inflammation. And I think that's the most important thing. So we have better blood flow. And we can talk about sexual health, which is really important. About 40% of men over 40 have some degree of erectile dysfunction. And this is a major problem that is impacting intimacy, relationships, the ability to connect. And sauna wonderfully increases nitric oxide and improves vessel function. So especially for men that have sleep apnea and sleep disordered breathing or type 2 diabetes, they would really benefit from going in the hot tub or the sauna because of its ability to improve blood flow and circulation. So many benefits. We can go on and on, talk about heat shock proteins. But let's talk about the opposite of heat, and that is cold. So as we mentioned with the AMA, the pearl divers in Japan, scientists are now starting to ask, hey, what makes these women really unique? They're the only population in the world that volitionally go and do open cold water swimming without wetsuits, and they've been doing this for hundreds of years. Maybe we should study these people and look at their rates of cardiovascular disease, of depression, of all these different chronic conditions. It turns out, as I mentioned before we started, the rate of cardiovascular disease in this population is significantly lower because of the adaptations that come from getting cold on purpose. So when you get hot, your blood vessels will dilate, will relax, circulation will increase, the blood from your core goes to the periphery. Guess what happens when you get cold? The opposite happens. So blood from the periphery will go to the core to warm up the brain, the vital organs. That's why when it's cold out, your hands and feet are the first things to get really cold. People want to bundle up because blood is being diverted from the periphery to the core. But just like when you habitually exercise and your muscles get bigger and you can do more reps and you get stronger, when you habitually get cold, and let me just pause, this is going in a shower. This is exercising outdoors. You don't need to get into an ice bath. We have great companies now that are making commercial products and making cold more accessible. Just getting cold by going outdoors and wearing minimal clothing is practicing deliberate cold exposure therapy. And that's what's really unique. So when you deliberately and habitually get cold on purpose, you start to acclimate. And one of the acclimations or adaptations linked with deliberate cold exposure is improved blood flow to the periphery. Now you might say, well, who really cares about that? My blood flow is fine. Well, if you look at diabetics or people that are demented or obese, they generally have really poor blood flow in the legs. Their toes, they have emphysema, cellulitis. These are the consequences of poor circulation and poor blood flow, especially to the lower extremities. Studies out of Denmark show that diabetes starts regionally in the legs. Okay, so if you will do biopsies, let's say in a full-blown insulin-dependent diabetic, oftentimes their upper body muscles are still insulin sensitive. It's their legs. There's something special about the legs. So if you can improve circulation in your legs by getting hot and cold on purpose, you can support metabolic health and hopefully enhance your health span so you can live independently. You don't need to go into an adult family home or a nursing home or have 24-hour care. That's what we're all trying to avoid by going to these talks. So deliberate cold exposure is really great for improving blood flow. We talked earlier about your mood. Why do you feel better when you get cold on purpose? Because you increase the same hormones that you increase during exercise, adrenaline and noradrenaline. It turns out that these hormones make us feel good, but they also help us oxidize fat. So research shows that people who get cold on purpose after a deliberate cold exposure session, for example, just several minutes, they increase or oxidize more fats. Who's tested their glucose after a cold immersion tank, ice bath? Any real nerds in here? Okay. All right, well, maybe you can do this next time. Go test your glucose, get in a cold tank, and test your glucose after. Your glucose drops like a rock. This is a phenomenal way to decrease your glucose. So it could be something that you could do after dinner, for example, before bed, just a quick 30-second plunge. It will dramatically decrease your glucose. And so that's really important. You might say, well, how is it decreasing glucose? How does getting cold decrease your glucose? Well, when you get habitually cold and you acclimate to the cold, you increase a subtype of fat known as brown fat, specifically BAT or brown adipose tissue. It turns out that BAT is really metabolically protective. Who's heard of brown fat? Probably many of you. Okay, amazing, well-educated room. Awesome. So when I studied biology back in the early 2000s, I went to Western Washington University. When we talked about brown fat, I remember the teacher specifically saying, oh, this is only in babies. Brown fat is only in babies. We all heard that, yes? Well, it turns out that as adults, we should have brown fat. The quantity of our brown fat is directly related to our metabolic health. The more overweight or obese you are, and the more metabolically compromised you are, the lower brown fat is generally observed. But here's the cool part, is brown fat is inducible. Just like muscular hypertrophy, you can change your body. You can change the composition of your fat. And the way that you do that is very similar to exercise. If you only do one cold plunge a year, don't expect your brown fat to change. If you only do one workout a year, don't expect to be super fit, right? You have to do this 3 to 5 days per week. And so I did a cold shower this morning, just in the Airbnb. The groundwater here right now is actually pretty darn cold. So that was pretty shocking. I mean, it's actually colder than where I live in Washington. I was surprised. So you don't need fancy equipment to do this, but you need grit. You need to make this a habit. That's the most important thing. And so as uncomfortable as it is to wake up, go in the shower, turn it on cold, there are many benefits, I can assure you, from increased circulation. And I'll just go back to circulation in a moment, but I think it's important to talk about it as we get closer to the darker times of the year, winter and shorter days and longer nights. A lot of people are affected by that. Seasonal affective disorder is quite prevalent. I don't know the prevalence of psychotic use or antidepressant use in New York and beyond, but I'm sure it's quite high like it is in Seattle. Research shows that people who just did 4 minutes in a deliberate cold exposure tank had marked improvements via functional MRI. This is a way to look at the brain and look at different brain centers that are responsible for contributing to a good mood and feeling good. These various regions were increased by just getting cold on purpose. And you mentioned earlier, one of the things that you feel when you come out of a cold tank is you feel really freaking good. So it's a natural antidepressant, if you will, a natural anti-anxiety. I have several clients who have sleep issues, especially women going through menopause. Sleep can be very hit or miss, and the ebb and flows linked with sleep. Doing a short 30-second cold shower in the evening can actually, as scary as it sounds and stimulatory as it sounds, as you get habitually used to doing this, it can improve sleep and lead to deeper sleep. Because it turns out there's an optimal sleep temperature, and your body actually prefers to be a little bit colder during your deep stages of sleep. And so you can help your body out by getting cold before you go to bed so that you actually sleep better. So many benefits to getting cold on purpose, but the hardest part is actually doing it. Just like for people that have never exercised, it's hard to get them actually to go into the gym. So I challenge all of you to do 30 days straight of cold showers. Who can do that? 30 days. All right. How long? This is a great question. Just think about this question in context. It's like, how long should you work out? Well, if you've never worked out before and you want to look like some super fit person who does 90 minutes a day or training sessions, it depends on the context is what I'm trying to say. So when you start out, just do 30 seconds. Just set the bar low. I think it's more important to be consistent as opposed to focus on the duration of the cold. Because if you set the bar too high and you see an expert on YouTube or Instagram that does 5 minutes, you're going to think, well, I can only do 20 seconds, so I must suck, so I'm not going to do it. So I think consistency is more important than total duration or actual ideal temperature. As long as you feel, this is the most important point, you just need to feel cold afterwards. And here's the thing, the duration. If you set the bar low, just say 30 seconds for 1 week, then I'm going to do 45 seconds a day for another week, and slowly increase over time. You're going to get more and more acclimated, and it's going to be easier and easier. So actually, 30 seconds, you may not feel that cold afterwards once you start doing this habitually. And so it's important, though, that you want to feel a little bit uncomfortable. Just like when you're working out, an interval sucks. But those intervals help with your VO2 max, your aerobic threshold, your lactate threshold, right? So if you look at heat and cold as an interval, as a little bit of periodic discomfort that builds the adaptations that lead to the metabolic improvements, that's the best way to do it. But I think 30 seconds with cold groundwater is sufficient. And then if you want to, for a bonus, maybe 1 day a week, you take some friends and go in the Hudson River for 5 minutes. Something like that. I don't know. I don't know the temperature that, sorry. Yeah, there's bodies of water around here that you can get in that are very cold. Where do people cold plunge in New York City? Okay, in a tub. But you could go in a body of water, yeah? Come on, you can do this. I'm sure people do this. Go to the ocean. You could. Rockaway. Okay. So no one swims in the river. All right. Because it's gross? Okay. That was about, okay. Go to Rockaway, not in the river. All right. But you can make this social. This is a really cool thing. Instead of going to the bar and getting a bunch of drinks or sitting around watching football, drinking beer, go in the sauna with people. I've had the best conversations of my life with friends in the sauna because you're challenging yourself together. You're going in the cold plunge afterwards. You can make it a really great shared experience. So I think that's really beneficial. Okay, so any questions? We'll cover just basic labs in the last 7 minutes, but I see a question here. This is a phenomenal question. So I think contrast therapy has a lot of value because when you're getting hot and cold, you're stimulating different bodily systems, so to speak. And when you get hot, you're causing blood flow to move away from the core to the periphery. When you get cold, you're doing the inverse. But I think for this purpose of activating the brown adipose tissue, which is totally inducible, by the way, and basically we're converting our white fat to behave like brown fat. It's called beiging of the fat cells. I think it's better to start with just straight cold. Do your shower, do the scrubbing, wash your hair, do all that, and then finish with a little cold as well. So before I invested in a cold plunge, what I would do, and it sounds like a lot of work, kind of a lot of work, is I would just do a shower by myself, just cold. No washing the body. It's just a straight up cold shower to get uncomfortable. Then I would go about my day a little bit and then do the hot shower, wash your hair, do all the things. But I think if you're trying to save time, I would bookend the shower with cold. So you start out 30 seconds with cold, do the warm, and then finish off with 30 seconds of cold. But this is in fact, there was investigators that wanted to look at this, and they published, I can't remember where they were from, this research group. They were working with a big employer, and they wanted to see if people who did cold showers, if they would suffer any less from the cold and flu season during the wintertime. And so they randomized people to take a cold shower or not. And they looked at how many sick days these people in the two different cohorts. What they found is there was a 20% difference in terms of the number of sick days reduced in the people who did cold showers compared to people who did not. So we have these observational studies now finding that there are indeed benefits, to this, especially when it comes to practical things like, not getting sick as much. And so I think that's why I think bookending it, because if you get super hot, here's the thing. You do a nice hot shower and you turn on cold, what do? You jump out or you turn it off, So I think it's better to start out with just 30 seconds of cold or a minute of cold if you can get super, super cold, then do your shower, then bookend it. Yeah, good question.
Is there any data behind pairing
Love this question. Yes, I'll just paraphrase the question. Should you do cold showers after an exercise session, and is there any benefit or detriment? So it turns out, if we think about what does cold do, cold reduces inflammation. If your aim is hypertrophy or building muscle, you don't want anti-inflammatory things in the post-exercise window. We've all heard about how antioxidants can be counterproductive to muscular hypertrophy, right? So you don't want to take your NAC or your vitamin C or things like that after exercise. You want to wait at least several hours because part of the hypertrophy or the adaptations from exercise are caused by the damage and then you get all the signaling properties in the post-exercise window. So for hypertrophy-specific applications, you do not want to do cold immediately after exercise. You'd want to give it at least 3 to 4 hours, which I know can be challenging because if you go to the gym, then you go in the sauna, then you want to get cold, you just want to make it time efficient. So if hypertrophy is your ultimate aim, I would say at least go in the sauna first and then do cold plunge, beforehand. Don't just go from gym to ice bath. Now, if you're doing an event, let's say you're doing a CrossFit event, or you're doing multiple training sessions during the day, and you want to reduce your inflammation and enhance your recovery for that consecutive workout, I think it's probably a good idea to go in the ice bath initially to recover so that you're fresh, if you will, for your next workout. So this is where context comes in. But you bring up a good point, and that is that one of the benefits of deliberate cold exposure therapy is that it's anti-inflammatory. We've been using ice forever. If you were to roll your ankle, what's your doctor going to say? Oh, elevate and put ice on your ankle. And this is the benefit of getting your full body in an ice bath is you're decreasing systemic chronic inflammation. There's anti-inflammatory properties there. Great question. We got one here.
What about using a cold plunge as like a pre-workout? Like if you're going to go to a cold plunge before a weightlifting session?
This is a phenomenal question. So could a cold plunge be a great pre-workout? And that's what I often do. It's a phenomenal way because as we talked about, the hormones that are increased when you get cold are the very hormones that you increase when you start to exercise, adrenaline, noradrenaline. The only downside with that, several years ago I found, so I was doing this a lot when I was competing in powerlifting, and I didn't warm up my elbows sufficiently before maxing out on bench press, and I kind of pulled my tricep a little bit. It was like a 10-day deload kind of thing. It wasn't a big deal. But I would just say make sure to warm up your joints if you do cold and then you lift heavy. You want to really do a lot of accessories, get your joints warmed up so you don't cause an injury. But I found that if you naturally let your body warm up by way of exercise after deliberate cold exposure, you actually have a much better workout. It's really interesting. So one of the rate-limiting factors with exercise performance and power output is heat. So if you get super hot, there's this inflection point with maximal oxygen uptake and lactic acid and power output. So if you keep your body cooler, you can actually have greater force production by way of muscular contraction. So I think there's actually some value there of doing it before, as uncomfortable as it is. But the benefit of doing the exercise is it warms you up naturally. Other questions in the back? This is a great question. Steam versus sauna. Do what you like. Sauna has been more studied because it's easier to control. Most people have access to a sauna, whether it's an infrared sauna or a Finnish sauna. Not many gyms or fitness facilities have a steam room. But as I mentioned, New England Journal of Medicine shows that just getting in a hot tub reduces diabetes and improves blood sugar control. We know that any heat is better than no heat. So if you prefer the steam, do the steam. The reason why I'm not a huge fan of steam is I don't know, what's in the water. Is it filtered water? Where's the water source coming from? You're inhaling this stuff. I mean, I don't want to be too nitpicky with all this, but there's a lot of crap in our water, and do I really want all that steam of city water, arsenic, cadmium? People put antidepressants and Prozac in the water. I don't know. I mean, what's the consequence of that? I don't know. And I just like sauna. But if you like steam and you don't like sauna, do the steam. Great question. Yeah, this is a really good question. So I don't know if there's a point of diminishing returns. I think you can cause nerve damage. And so I think there is a point where you're not really getting any benefit there. But again, I think the consistency is more important than the total duration. When you get to the point that your muscles are shivering, this is called cold-induced thermogenesis. This is sort of like, okay, well, you've hit that threshold, just like when you're failing on a bench press. It's like, do you need to keep failing for 17 sets? Probably not, Yeah, so I think there is some benefits to getting to the point where you're shivering. You're like, oh my gosh, this is wild, right? But do you need to suffer through another 5 minutes of that? I don't think so. So I think if you can periodically get to that point where you're super shivery, then get out, and then maybe do another session if you are that ambitious. Yeah.
So, and again, I ask this question because I go on the island once a week.
Nice.
It takes an hour to get out there, and I'm kind of going, shit, how long do I stay in the water for? And it feels like I need to stay in 15, 20 minutes.
To get to that level.
Make it worth my while.
100%. Yeah, because the water temperature is not sufficient. If there was an ice bath, it might be 4 minutes. It might be 3 minutes. But yeah, getting to that point, because you are investing an hour of your time to drive out there. If you're doing that in an open water setting, you probably want to get to the point where you're shivering, then get out. I think that's a good strategy. But if you do that every day, that takes a lot of time, first of all. And that can be uncomfortable. So this is what's nice about this, is you can get that cold once a week and still have long-term favorable improvements in your metabolic health and brown adipose tissue. Yeah.
What's the ideal temperature for a sauna? I mean, I use a dry sauna, and sometimes it can either range from 185 to like 220.
Yeah, well, I think it depends on where you start, but I think if you're brand new to this, 185 is perfect. And if you can stay in there for 10 to 15 minutes comfortably, if you want to invest in a wool sauna hat that can help protect your hair. One side effect of sauna is some people can lose their hair just because you get so hot and dry. It's not dramatic, but you can get thinning of the hair, so wear a wool sauna hat. And then as you get more acclimated, you could be rocking at 220 for 20 minutes and be fine. So I think over time, just build up to it, just like you would build up to exercise. But also pay attention to your life load and your stress. If you're super stressed, you didn't get much sleep, all these things, it's okay if you can only do 12 minutes. You're like, this is all I got today. Just like when you go to the gym, you try to give it all you got, but you have jet lag, right? Any other questions? Yeah.
So when you come up with these numbers that for different timing and stuff, so is there a lot of research done on the college lines on if a human X amount of time, these are the facts, you release this, if you're in 3 minutes, 4 minutes, 5 minutes, there's a different response for each duration, and is there study on that to back it up to show the human does this, 30 seconds, like you said, one thing 30 seconds every day, obviously building up to it, but other things are more, and is there,
Science to validate what we're talking about. This is a great question, yes. So the science to validate what we're talking about comes mostly from Jari Laukkanen in Finland. And when it comes to sauna specifically, they look at 15-minute blocks. And usually what they're doing is a classic Finnish sauna gets up to about 210 degrees. So they're looking at 3 15-minute sessions, and they'll space it out with a 5 or 10-minute break. So it's 15-minute blocks. And so usually that temperature is between 190 Fahrenheit and 210 degrees. There's a little variance in the ideal temperature. Now, when I was talking about deliberate cold exposure therapy, there's not as much data to support this, but several studies are looking at 5 minutes at around temperature of like 35 degrees Fahrenheit.
and then backed up with blood work, so that individual gets out, they do the blood work, and they show, this is what blood work looks at 3 minutes, this is what the blood work looks at 4, 5, okay, 5 is the optimal because you get a more hormonal response or whatever the fact may be with your blood.
Well, most of these studies are like 8 or 10-week studies where they'll have people go and do a deliberate cold exposure or a sauna session, and then they'll do a baseline metabolic health panel, let's just say, or cardiovascular health panel. Then they'll look at 8 weeks later. There's been several short-term acute studies to look at the acute effects hormonally, immunologically in these short sessions, but those are usually smaller studies, 10, 15 people, things like that. But what I'm referring to with the 5 minutes of cold was a recent study on people doing a functional MRI and looking at different brain regions with mood. So yeah, but I think, again, there's the science, and then there's being practical about it. If you tell everyone here, do 5 minutes of cold, maybe 1% of people would do it. But if you say, hey, 30 seconds of cold, 80% of people would do it, and they might continue, and a year later, they're doing 5 minutes.
When I personally do the cold, it's not so much the cold, I feel great like 2 minutes after, and then my body just convulses like I'm having an exercise.
So here's the thing about that. As you habitually do that cold-induced thermogenesis gets better because what happens is there's all the metabolic induced thermogenesis that will start to become adaptive and you'll start to respond better. So that shivering, that happens. The first time I got into this in 2013, I was like, I can't work, like you're shaking and it's like, it's weird. But as you get more acclimated, your body increases metabolically, and I think that's where the longevity component is. So that non-shivering induced, the muscular shivering gets better over time the more you do it. How are we doing on time, by the way?
We're ready to wrap up.
Okay, maybe do one more question.
When I was living here in New York, I had access to a sauna that we had about 220, which was amazing. Now that I moved back home in New Orleans, my gym has a sauna, but it only gets to 140, and I do a sauna studio, and it gets to like 175. So to warm up, I do like push-ups in the sauna.
Nice.
But does that actually warm up my body to these significant degrees where it's like I'm benefiting from like 190-degree sauna? You know what I'm saying? Like,
Yeah.
the gold standard.
You're going to have to go in for longer. That's the thing. So you're probably going to have to do 30 minutes or 35 minutes. Yeah, and you can wear a sauna hat, and that will help accelerate the process. Oh, no, but still, yeah, just go on Amazon, get a wool sauna hat. This is a really cool thing that people do in Finland and all, and it helps you get there faster. Everyone, thank you so much for coming.